Speaker के mic के बंद please. Your Dr. Gautam. In the presence of my Guru, I won't dare to say Mishra. But I feel it's wrong diagnosis. Sincerely. And I can prove it. How? Please don't take it to heart, sir. I'll suggest, maybe totally I may be 100% wrong also. Your final diagnosis was left lower lobe pneumonia. In between, in the first slide you showed, it's a lady, pregnant, 22 years or 20 years. But in the advertisement of CAP meeting, you wrote 32 years. You can check. 32 years lady coming with multiple problems like all these things. MODS, sepsis, DSC. Unraveling the mystery of the diagnosis of 32 years lady. And one phrase was very important that clinched the diagnosis. That is Gestational Trophoblastic Neoplasm, GTC. This should have been consulted to an oncologist. GTC per se can cause a sepsis, per se can cause DIC, per se can cause multiple organ dysfunction syndrome, MODS, which happened in this case, and itself can be proved easily by increased human chorionic gonadotrophin high level. I don't know why it was missed. And so let me complete it. You can counter it. The diagnosis, as far as possible, unless proved otherwise, I could say I can pinpoint it is nothing but that diagnosis. If you ask an oncologist, he will definitely agree to my diagnosis. It is trophoblastic neoplasm of gestation, GTN. Gestation trophoblastic neoplasm. It definitely causes, that's the trigger of all the problems. That is the trigger of all the problems. Sepsis, even sepsis can cause liver problem, renal problem, kidney problem, every problem. Sepsis. And you have given the treatment. Treatment was correct. Finally she recovered because of so much of antibiotics. Fine. Outcome was fantastic. Had it been the diagnosis was also the same. But the query remains unraveling. You have put the diagnosis and unraveling the mystery. That is the mystery. If you ask oncologist or a hematologist also, might have given the diagnosis rather than totally depending on yourself, obstetrician and physician have been dealing the case. It's a multi-disciplinary treatment should have been done, including oncologist, hematologist, physician and obstetrician. Now your takes.
With history of gestational trophoblastic neoplasia and with the lung mets history, beta HCG was also done, sir. It came back normal, 6 international units, and medical oncology referral was also.
Why the age was totally different? You are given in the published 32 years, and here you are showing how many years? 20.
24, sir.
24
patient age.
Why 8 years disappear? Why so much of despair? And then there is a different patient.
Female is of 24 years.
You can check what you have been published. It's 32 years in Rasin. And then yes or no? He agrees. It's 32 years. How 24 years become? How the lady has become suddenly 24 years? Unless it's a different lady.
24 years.
If it is 20 years, then the published thing was 32 years. Agree, sir?
Definitely.
I'm definitely correct. Whenever I am checking, I counter check. Always counter check. I'm a Fauji, army guy.
That may be a typing mistake.
So it is